Hi, I'm Lance Liberti, co-developer of the patented Advanced Arthritis Relief Protocol. And I'm here to share with you today something that addresses one of the most pressing concerns of the elderly, and that's degenerative joint disease, particularly osteoarthritis of the knee and shoulder. In the 65 plus age group in our country, they control more than 82% of the purchasing power. And seniors today are not like seniors of the past. They're not going to kick back on their recliner and watch TV all day. They want to go outside. They want to engage in athleisure activities. They want to play golf and dance and tennis and pickleball and travel the world. Grandmas and grandpas aren't what they used to be. That being said, the treatment options for osteoarthritis of the knee have been very limited in the history of our country, mostly relegated to corticosteroid injections and knee replacement surgery, which are not only risky and costly, but oftentimes result in the inability of people to engage in normal activities, let alone athleisure activities. So the future of medicine, at least the next 10 to 15 years, we know it's going to focus on lifestyle enhancement for the elderly. What are those pressing concerns? What can we return to them? What do they want to do with their golden years? Well, in the United States, amongst those pressing returns, osteoarthritis is right at the top. In fact, osteoarthritis is the third fastest growing diagnosis in the elderly, behind only diabetes and dementia. In addition to affecting the elderly, osteoarthritis affects 2 in 3 people who are overweight. In the United States, more than half of our population is overweight. More than a third of our population is obese. Despite growing use of GLP-1s and other weight management techniques, we are still suffering with an obesity epidemic in our country. That increased load over time results in faster onset of degenerative joint disease, such as osteoarthritis of the knee. So this is not only something that's already in high demand, with more than 33 million Americans suffering from osteoarthritis. That's about 1 in 10 U.S. citizens already has osteoarthritis. We know that this incidence is going to continue to grow rapidly. In fact, the CDC projects that nearly 80 million Americans will be diagnosed with osteoarthritis by 2040. So we're going to see more than a doubling of this disease over the next 15 years. We know this is a big growth area. We know that the previous standard of care is not working. We've seen regulatory changes such as Medicare in May of 2017 saying that you have to try and fail a series of intra-articular injections, unloading, bracing, or DME items, and physical therapy or home exercise. So what we're proposing to you here today, while it might be revolutionary in its outcomes, is not controversial in its proven ability to work. In fact, it fits right into the regulatory framework from Medicare, from Medicaid, and from commercial insurers throughout the country. So what is the Advanced Arthritis Relief Protocol? It's a process of combining intra-articular injections of hyaluronic-acid products like Hyalgan and Genviscate 50 using fluoroscopic needle guidance and a small amount of contrast dye, not only to confirm intra-articular placement, but to do what's called an arthrogram and to ensure that that synovial capsule is intact. The patient's not suffering from a synovial tear. They're not leaking synovial fluid, because if we inject that patient, they're not going to get an outcome. Now, this diagnostic technique not only allows us to confirm our patient's a good candidate, but it drives a significant amount of revenue, typically about $800 per patient of additional diagnostic revenue. Additionally, fluoroscopic guidance not bundled in the extremities. So when you do a fluoro-guided injection of the knee, it's going to pay out separate from the joint injection, unlike when you do a facet injection in the back or use digital ultrasound, which has been bundled with large joint injections since 2015. We also utilize unloading knee bracing to increase the joint space, particularly in patients with Kellgren-Lawrence grade 3 and 4 osteoarthritis, so that the injectable can actually get into that compromised compartment medially or laterally and do its job. And I'll show you in a few slides exactly how that works. We combine this with a home exercise protocol with a device to help patients do flexion and extension activity while seated 10 minutes a day. Very simple. Covered by Medicare and most major insurances as a monthly rental. This home rehab device adds over $2,000 of additional revenue to the case. On top of the bracing and injection, we've got case values through Medicare that are typically about $11,000 for a bilateral osteoarthritis patient around the country, with a cost of goods of only about $1,100. So if you're doing knee injections right now with corticosteroids or using physical therapy or other interventions, if you're not making $9,000 or more in profit per patient, we have an excellent value proposition. I'd love to book an individual webinar with you to go over your particular practice, your local reimbursements, and what type of results this could provide to you both clinically and financially. And we finish this all off as being an excellent feeder system for regenerative medicine. You know, we call it moving goalpost syndrome in our business. A patient comes in, they just want to get from the couch to the kitchen without having to grab onto the counter, without having to take 2 more Advil. and to go about their day. Once we get these people out of pain and back to normal function, now comes that shift. Now they want to do these athleisure activities. They want to golf, they want to dance, they want to travel, they want to pickleball. So how do we address moving goalpost syndrome? Through regenerative medicine. We use proven techniques such as platelet-rich plasma that's been shown to increase meniscal cell proliferation by over 800%. It's been shown to reduce the need for follow-up arthroscopic surgeries by more than 16 times. So very well proven autologous therapy, actually starting to be covered by some insurers such as TRICARE, some commercial insurers, although it's still mostly a cash modality. We also use human tissue products like exosomes and mesenchymal stem cells in more extreme cases. And I'll show you some before and after imaging here as well as part of this overview. Now, the knee bracing is a very important component. I know people don't really get excited about knee bracing per se, but here's why it's such a big deal. When a patient comes in for their consultation, we explain it to it like if you're dealing with a civil engineer. Let's say you've got an old building, the foundation starts to crumble. What's the first thing the engineer does? They put up a scaffolding to hold that building steady while they pour a new foundation. Once that foundation sets, the building's steady and stable for another 100 years or so. That's how this knee brace works. We're able to take medial bone-on-bone contact like the image you see here and increase that joint space so the injectable medications can actually get into that compartment and do their job. And this holds the joint space open while we're stimulating the synovial to produce more hyaluronic acid on their own and restore normal bioactivity to the joint capsule. This also helps to hold the space open while we're using regenerative medicine techniques to increase meniscal cell proliferation and to regenerate hyaline cartilage as well. So the patient wears this unloading knee brace for about 90 days while we're rebuilding these underlying structures. And the same knee brace we sell that works for medial also works for lateral. Here we can see a pre and post in a lateral patient with the knee brace in the field of image. So this piece of technology, a device that costs around $100, reimburses more than $1,200 in most regions around the country through Medicare. So you're talking about a 10 times ROI on this knee brace per knee. Most patients have two knees. Plays a big role in setting the clinical stage to get positive outcomes. So if you've done HA injections in the past without guidance, without bracing, and if you've not gotten good results, I want to propose to you a new way to do this as part of our patented Advanced Arthritis Relief Protocol. And we finish it off with a home exercise protocol that helps to strengthen the ligaments, reduce laxity, break down or reverse ligament contractures if the patient is very immobile or wheelchair stricken. And the results from this protocol are truly extraordinary. In a multi-center randomized case study of nearly 400 patients, only one patient had no reduction in pain, improvement of function. More than half of the patients had a 50% or greater reduction in pain, improvement of function. In fact, I believe it was 92.7% of the patients had a 50% or greater reduction in pain, improvement of function. Overall, visual analog pain scales went down by 77% in this multi-center randomized case study. So we know it works. We know it drives results. We also have plenty of imaging that shows our ability to increase joint space and to stimulate the regeneration of normal physiology inside the joint, such as meniscal and hyaline cartilage. We're able to achieve this because of the guidance, because of the unloading, because of the home exercise protocol that's combined with it to introduce weight-bearing activity to further stimulate those synovial again. And it works very well. We've also got compelling social proof, thousands of written and video testimonials from patients, hundreds from providers. We've successfully treated more than 500,000 cases nationwide since we started this protocol back in 2010. So what's a real case look like before and after? This is an 86-year-old African-American female patient, came into our original facility in southern New Jersey in January 2011. Here on the left-hand side, you can see she's very badly bone-on-bone contact, osteoporotic. She happens to be obese, suffering from COPD, diabetes, and early-stage heart failure. She's not a good candidate for surgery, not only because of those comorbidities, but also because of this titanium rod that was installed from a previous femur break, as she has a history of falling. Here's the same knee 26 months later after 2 rounds of injections, bracing, and therapy. Not only did we increase the joint space, which you can see here, but there was an increase in density of muscle and bone because she transitioned from a wheelchair to a walker to a cane to walking under her own power. Got out of that skilled nursing facility, went to an independent living facility, was able to shop for her own groceries and cook her own meals. Lost over 60 pounds, became less dependent on insulin. Her COPD went away. Her ejection fraction went up, and she came out of congestive heart failure. This is not just a program for addressing pain and mobility. It is a program that extends life and quality of life in mass. It also creates an excellent opportunity to create new patients for the regenerative medicine division of your practices. In cases that don't respond extremely well to traditional intra-articular HAs or the patient maybe doesn't reach the recovery that they were hoping for, we'll use injections such as platelet-rich plasma or human tissue products to stimulate the ability of the body to regenerate lost or damaged tissue. This gentleman here on the left is from one of our clients outside of Pittsburgh, Pennsylvania, an 88-year-old male. He was able to return to golfing, something he had not done for more than 17 years after undergoing 3 PRP injections 3 months apart. So we know this works. We've got clinicals that support it. We've got actual published research studies, university-backed, that prove this. But more than that, it's the anecdotal evidence. It's the x-rays. It's the individual patients. It's the thousands of cases that we've seen resolve with regenerative medicine after completing a series of hyaluronic acid injections that truly prove this works. And we've compiled all that clinical data. Happy to share it with you, as well as to review it during your private webinar when you book with us. The value proposition for these patients is really simple. When we started this back in 2010, it wasn't yet required to be tried and failed prior to knee replacement surgery. It has been since May of 2017 when CMS updated their guidelines there too. But even without having to do this to get a prior authorization for surgery, which now you do, patients don't want to undergo surgery. They don't want the big scar. They don't want the risk of anesthesia. They don't want the post-operative physical therapy. Even though knee replacement surgery has advanced a lot, the hardware's gotten better. We're no longer dealing with things like leaky cobalt and stuff like we had back in the early 2000s. It's still a very invasive and very expensive procedure. Average patient out-of-pocket cost for a TKA is around $7,000. Average out-of-pocket cost for this protocol is about 90% less than that if a patient's not fully insured with Medicare and a secondary if they don't have an F plan. So it's a very, very easy value proposition for the patients, especially now that it has to be tried and failed before surgery will be authorized anyway. So if you've got patients in your practice that are struggling from mobility-related diseases, the Advanced Arthritis Relief Protocol is a great potential solution, but it's also a great way to get patients into your practice. With a variety of marketing materials, print, direct mail, TV, radio, excellent digital marketing funnels. But I just want to play a brief TV commercial for you that we use both on broadcast TV and digital marketing. Kind of explains this program, what it does, and why it might be a good fit for the tens of millions of patients suffering from mobility-limiting diseases.
Are you or a loved one currently suffering from chronic knee pain, arthritis, or osteoarthritis of the knee? Has physical therapy, surgery, steroid injections, ibuprofen, and other NSAIDs failed to provide relief? Then you may be a candidate for our Advanced Arthritis Relief Protocol. The AARP program utilizes the latest fluoroscopic guidance technology to deliver a new joint fluid supplement that cushions the knee and reduces pain. Specialized knee bracing is then applied to unload the knee and increase joint space. Finally, advanced rehabilitative therapies are performed to strengthen the muscles and ligaments of the knee. When combined, these treatments have helped many patients reduce or even eliminate their joint pain and return to normal active lifestyles. The best part is the AARP program is covered by most insurance, including Medicare. Tired of living with knee pain? Then call the number on your screen right now to see if you qualify for our Advanced Arthritis Relief Protocol.
When we started running that ad on the midday news, ABC6 in Philadelphia, we'd get over 100 phone calls every time it aired. These advertisements have been producing results for over 15 years consistently. As the population ages, the results are only getting better and better. There's huge demand for this, plenty of patients that need it, plenty of patients that are frustrated with corticosteroids, oral NSAIDs, and the existing standard of care. I am telling you this, if you put the word out there, people will come. Getting new patients for this has never been a weakness of our program. In fact, we received well over 400 phone calls a week for more than a decade in our original facility before we sold it. So there's huge demand for this, actually have generated hundreds of thousands of leads nationally for this, with hundreds of thousands of cases successfully treated. So big demand. And our turnkey osteoarthritis solution allows you to capture and capitalize on that demand, delivering a clinically significant protocol that is also extremely financially rewarding. Our combination of fluoroscopic guidance of these injections, unloading, bracing, and the home exercise protocol drive extraordinary clinical outcomes, while the average case value is well over $11,000, with net profits exceeding as much as $9,000 per patient across the country at Medicare's allowable fee schedule. So it's a very, very lucrative program. But at the same time, if you compare that to the cost of knee replacement surgery, about $45,000 per knee, our program's about 90% less costly than surgery. So even the insurance companies themselves are a fan of this because it's a cost savings opportunity for them. Additionally, if you don't have the infrastructure to implement this, what if you're a chiropractor or a naturopath or a physical therapist or you own a med spa? We offer the staffing. We offer the insurance credentialing. We come on site and do the clinical training and certification for the first round of patient care. We make sure you can actually implement this program and be successful with it. Because as a practice owner, I've owned multiple practices across multiple states. I am not immune to failure. Like many of you, I've invested in equipment that just became very expensive paperweights and gathered dust that we did not create an ROI on. So if you're going to invest in a program or equipment for your practice, it's really important to know that there's a system behind it to help turn it into a revenue center. And this is a bell cow service that will become the largest revenue pillar in your practice in most instances. In fact, we've implemented with clients that did personal injury, work comp, lifestyle medicine, functional medicine, concierge medicine, all these different scopes of practice that oftentimes have stopped their previous business model to focus on our knee pain program because of how successful it is and how consistent it is throughout the country, including driving new patient flow. Here's a little sneak peek at one of our previous installations. So we bring in all the equipment, medication, supplies, training, marketing, credentialing, templates for documentation and billing and compliance to make sure you can replicate the success that the hundreds of clients we've implemented with previously have as well. It's a very reliable program. So what's next? If this sounds like a good idea to you and you'd like to learn all the fine details as well as see your local fee schedule and have a customized pro forma created for your patient volume and payer mix, all you have to do is book a risk-free one-on-one consultation with me. You can do so at either of the two links on screen here. If you're wondering if you can really generate $2 million a year or more of new revenue to your practice, this is not hyperbole. We have a full earnings pro forma you can check out with all the CPT codes that you can cross-reference. This is a very lucrative and very in-demand service center. In fact, I have multiple clients who have generated tens of millions of dollars annually and grown from 1 to 2, 3, 4, 5, 6, 7, 8, 9 locations around the country in different states. We've actually had a couple clients that have gotten up into the 9-figure range valuation of their businesses. So this is a real winner and has resulted in a lot of our clients having huge exits through acquisition with PE, VC, hospital groups, and even insurance companies looking to expand into direct primary care, such as Cigna in Florida, for example. So if you'd like to take the next step, learn all the fine details about this program, I'm happy to spend 45 minutes to an hour with you going through all of it, answering any questions you might have, as well as meeting with the rest of your team should they have any questions clinically, operationally, from a compliance perspective or a marketing and business development perspective. No obligation, no cost, and we're going to give you some actionable insights that you can take back to practice, even if you want to pick and choose little components of what we do and implement it into your daily workflow and business model. No harm, no foul. Come get that free information. I look forward to meeting you and hopefully helping your patients get their mobility back and creating an exit strategy for your private practice unlike any that you've been exposed to in the past. Please take advantage of booking this risk-free, no-cost private webinar at the links below. Thank you very much, and I look forward to seeing you very soon.